Canine parvovirus, often called Parvo, is a highly contagious virus that poses a serious threat to dogs, especially puppies. This nasty virus attacks the cells that line a dog's intestines, causing severe gastrointestinal distress. Parvo is a resilient virus, able to survive in the environment for extended periods, making it a constant concern for dog owners. Parvovirus is spread through direct contact with infected dogs or their feces. It can also be transmitted indirectly through contaminated objects like food bowls, shoes, or even our hands. This virus is particularly dangerous for unvaccinated dogs and those with weakened immune systems. Understanding parvovirus is crucial for every dog owner. Knowing how it spreads, its symptoms, and how to prevent it can make all the difference in protecting our furry companions. This essay aims to provide comprehensive information about canine parvovirus, empowering dog owners with the knowledge necessary to keep their beloved pets safe. Imagine a microscopic invader, so small it's invisible to the naked eye, yet powerful enough to wreak havoc on a dog's body. That's parvovirus. This tiny virus has a big impact, attacking rapidly dividing cells in a dog's intestines, bone marrow, and sometimes the heart. When parvovirus enters a dog's body, it heads straight for the lining of the intestines. These cells, responsible for absorbing nutrients and maintaining a healthy gut, become casualties in Parvo's assault. As the virus replicates, it damages and destroys these crucial cells. This destruction leads to severe inflammation and prevents the intestines from functioning properly. The body can't absorb nutrients or retain fluids, leading to dehydration, weakness, and a cascade of other health problems. In severe cases, parvovirus can damage the bone marrow, responsible for producing white blood cells that fight infection. This leaves the dog vulnerable to secondary infections, further complicating their recovery. Understanding how parvovirus operates within a dog's body highlights the importance of early detection and aggressive treatment. Time is of the essence when it comes to parvovirus. Recognizing the enemy early is crucial for giving your dog the best chance of survival. Parvovirus symptoms typically appear within 3 to 10 days after exposure. One of the most telltale signs is severe, often bloody, diarrhea. The diarrhea may be accompanied by vomiting, leading to rapid dehydration. Affected dogs often lose their appetite and become lethargic, lacking the energy to even stand. Fever is another common symptom, indicating the body's attempt to fight the virus. As the virus progresses, dogs may experience abdominal pain and discomfort, evident through whining or a hunched posture. If you notice any of these symptoms, especially in a puppy or unvaccinated dog, immediate veterinary attention is crucial. Remember, early intervention significantly increases the chances of a successful outcome. Diagnosing parvovirus involves a combination of a physical examination and laboratory tests. Your veterinarian will begin by asking about your dog's history, including vaccination status, recent exposure to other dogs, and the onset of symptoms. A thorough physical exam will assess your dog's overall condition, checking for fever, dehydration, abdominal pain, and other clinical signs. To confirm the diagnosis, several laboratory tests are typically performed. One of the most common tests is an ELISA test, which detects the presence of parvovirus antigens in the dog's feces. This test provides rapid results, often within minutes, allowing for prompt treatment. In some cases, additional tests like blood tests or fecal cytology may be recommended to assess the severity of the infection and rule out other possible causes of the symptoms. Section 5. Waging war on parvo treatment strategies. Treating parvovirus is like waging a war against a relentless enemy. It requires a multi-pronged approach aimed at supporting the dog's body while it fights the virus. There is no cure for parvovirus, but with aggressive supportive care, many dogs can recover. Hospitalization is often necessary to provide intensive care and monitoring. Intravenous fluids are crucial to combat dehydration and electrolyte imbalances caused by vomiting and diarrhea. Antibiotics are often administered to prevent secondary bacterial infections, which can be life-threatening in a dog weakened by parvovirus. Antiemetics may be prescribed to reduce vomiting and nausea, making the dog more comfortable. The road to recovery from parvovirus can be long and challenging, often taking 1 to 2 weeks or even longer in severe cases. The key is to provide the dog with the best possible supportive care to give them the strength to fight the virus. Section 6. Shielding our companions. Parvovirus prevention. Preventing parvovirus is far more effective and less heartbreaking than treating it. Vaccination is the cornerstone of parvovirus prevention. Puppies are particularly vulnerable to parvovirus and require a series of vaccinations to build immunity. The first dose of the parvovirus vaccine is typically given around 6 to 8 weeks of age, followed by booster shots every 3 to 4 weeks until the puppy is around 16 to 20 weeks old. Adult dogs need regular booster shots, usually every 1 to 3 years, to maintain protection. Maintaining good hygiene is crucial in preventing the spread of parvovirus. Clean and disinfect areas where dogs spend time, especially if a dog has been diagnosed with parvovirus. Avoid taking puppies to areas where unvaccinated dogs frequent, such as dog parks or pet stores, until they are fully vaccinated. Remember, prevention is a team effort. By taking proactive steps, we can protect our dogs from this devastating virus. Section 7. The importance of vaccination. Vaccination is not just about protecting individual dogs, it's about safeguarding the entire canine population. When we vaccinate our dogs, we contribute to a concept called herd immunity. Herd immunity occurs when a significant portion of a population is immune to a disease, making it difficult for the disease to spread. This helps protect vulnerable individuals, such as puppies too young to be fully vaccinated or dogs with compromised immune systems. Vaccines work by introducing a harmless version of the virus or a part of the virus to the body, triggering an immune response. This allows the dog's immune system to recognize and fight off the real virus if exposed in the future. While no vaccine is 100% effective, parvovirus vaccines have significantly reduced the incidence of this deadly disease. By choosing to vaccinate, we play an active role in protecting not only our own dogs, but also the well-being of dogs in our communities. Section 8. Protecting puppies. A special note. Puppies are particularly vulnerable to parvovirus due to their developing immune systems. Their immune systems are still learning to recognize and fight off infections, making them more susceptible to serious illness from parvovirus. Maternal antibodies, passed from mother to puppy through colostrum, the first milk, provide some protection early on. However, these antibodies wane over time, leaving puppies vulnerable. This is why it's crucial to follow your veterinarian's recommended vaccination schedule for puppies. The series of vaccinations helps to boost their immune systems and provide them with the best chance of fighting off the virus. During this critical vaccination period, it's essential to limit puppies' exposure to potentially contaminated areas and unvaccinated dogs. By taking extra precautions with puppies, we can help them grow into healthy, thriving adult dogs. Section 9. Parvovirus and the environment. Parvovirus is a hardy virus, capable of surviving in the environment for extended periods, even months or years. This resilience makes it a persistent threat, as it can linger in areas where infected dogs have been, even after those areas appear clean. The virus is resistant to many common disinfectants, making it challenging to eliminate completely. It can survive on surfaces like grass, soil, kennels, and even shoes and clothing. This environmental persistence highlights the importance of thorough disinfection in areas where dogs are kept, especially if there has been a known case of parvovirus. Using a bleach solution, 1 part bleach to 30 parts water, is one of the most effective ways to kill the virus. Steam cleaning can also be helpful in eliminating the virus from carpets and upholstery. Section 10. A final word: vigilance and care. Canine parvovirus is a serious disease that demands our attention and vigilance. By understanding the virus, recognizing its symptoms, and taking preventive measures, we can significantly reduce the risk of our dogs contracting this potentially deadly disease. Vaccination remains the most effective weapon in our arsenal against parvovirus. Coupled with good hygiene practices and responsible dog ownership, we can provide our furry companions with the best possible protection. Remember, early detection and treatment are crucial if a dog shows signs of parvovirus. Prompt veterinary care can make all the difference in their recovery. Let's work together to keep our dogs safe and healthy. By staying informed and taking proactive steps, we can create a safer environment for all dogs, ensuring they live long, happy lives. Section 11. Glossary of terms. Antigen. A substance that triggers an immune response in the body. Antibody. A protein produced by the body's immune system to fight off infections. Colostrum. The first milk produced by mammals after giving birth, rich in antibodies. ELISA. Test. A laboratory test that detects the presence of specific substances, such as viruses, in a sample. Herd immunity, a form of indirect protection from infectious diseases that occurs when a significant portion of a population is immune to a disease. Immune system, the body's defense system against infections and diseases. Intestine, the part of the digestive system responsible for absorbing nutrients and water from food. Vaccination, the administration of a vaccine to stimulate an immune response and protect against a disease.